Every child is unique, and so is their journey to health and well-being. At St. Francis Community Hospital, Kasarani, our pediatric department is dedicated to guiding that journey with expert care, compassion, and commitment to excellence. From the very first breath, our specialized neonatal services ensures your baby receives the best possible start. Our state-of-the-art neonatal intensive care unit is equipped to handle even the most delicate case, ensuring the smallest patients get the strongest support. As your child grows, regular health checkups are crucial. Our pediatricians provide comprehensive assessment, development, screening, and immunization, supporting health growth every step of the way. Health is more than just prevention. Our team of specialist pediatricians provide a range of acute and chronic conditions from asthma and diabetes to rare genetic disorders with advanced diagnostic and personalized treatment plans. We also offer comprehensive rehabilitation services, including physical, occupational, and speech therapy to help children reach their full potential, overcoming challenges with strength and resilience. Our hospital is open 24 hours a week. Visit us today for specialist pediatric care.
Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth.
Well, hello and a very good morning to you, dear viewer, and thank you very much for joining us on our Health Corner show right here on Capuchin TV with me, Maureen Kimani. This being your go-to show, we will bring an expert and we have insights about health and our world, and that's how we say as Capuchin TV, your health is your wealth. And of course, today we have a very interesting conversation that we shall be focusing on, that is orthopedic care. And just to break it down on health topics and in a very simple and a practical way to help you to live a better and healthier life. And of course, joining me in the conversation, we have a very beautiful lady, a representative from St. Francis Community Hospital in Kasarani. She will be shedding more light about this conversation that we are having today, making sure that our topic being stronger bones, healthier lives. That is what we shall be focusing on more. And in case you'd love to be part of this conversation, please do not hesitate to reach out to us on sharing your story, sending us feedback, and even asking questions about your healthier life. And of course, our guest will be able to answer all the questions here. Please do reach out to us on 0717 424 866. Or you can use the SMS number that is 21760, and we'll be able to get back to you as soon as we get your feedback. But allow me right now to welcome my guest here with me. A very good morning. Hello.
Hello.
You're looking beautiful.
Thank you.
It's good to have you here at Capuchin TV on our Health Corner show. But kindly, because it's the very first time we are having you here, could you please introduce yourself to the viewers, tell them who you are and what you do at St. Francis Community Hospital?
Thank you. Hello, good morning. My good name is Mary Ann Muthoni, an orthopedic and trauma technologist. I do my job at St. Francis Kasarani Mwiki, the trauma technologist. Thank you.
All right, it's good to have you here, and thank you very much for making time as we learn on how to prevent injuries, manage bone and joint pain, and of course maintain stronger bones.
Yeah.
That's our conversation today, and I'm very delighted to hear what we shall be able to share to our viewers.
Yeah.
But first, as we begin with the conversation, maybe for that viewer who is watching us and maybe they haven't even come close on this these terms. There is orthopedic, we have trauma in orthopedic, and we have orthopedic trauma care. Could you kindly break it down more a little bit on that?
True. So when we come in the orthopedic and trauma technology, we can just go and define the terms. Each term, it has its own meaning. We have the orthopedic, it's a twin name. Ortho comes with the bone, it means the bone. Pedic, it means peds, meaning the bone is a correction from zero, gradually growth. It begins from zero, it grows gradually. So the orthopedic means changing or correcting deformity. Then we have the trauma. Trauma means injury, like the accident thing scenarios. That is where the trauma comes in. Then technology is where you correct the deformity. So orthopedic and trauma is where we take care of the bones from zero. They grow, we regain their formation, and we are back to our lives again. That is the orthopedic and trauma technology.
And maybe some viewers are very concerned on why is it important even to have this conversation on our bones? Like, it's my bones. Please tell us, why is it so crucial to have this conversation and to enlighten the viewers on how bones play a very vital role in our body and, of course, in our daily activities?
Oh, nice. So now where we come about the orthopedic or the bone care, it's because the bone is the one that holds the body. If you don't have the skeletal part of your body, you can't stand, you can't be solid. If you don't have the bones, you just become, you something spongy. You just drop. You can't support yourself. So basically, the skeletal system is what supports your body. It keeps it in the shape that we have. It keeps it stable. It makes you support the weight that we bear. So that's why we need the bones and we need to take care of them. Once the bone is deformed, we can't function. You have the deformity. You can have the shortening. You become, maybe you can be amputated. You lose your function. So we need to take care of our bones to avoid being deformed. We have to maintain our physical good look. That's why we take care of the bones.
Okay, and how would you describe a person who has stronger bones and a person who has weak bones?
Oh, the strong person, you can do a lot. You're in a position to be a lot of weight. You can do your duties and all that. Unlike someone who is weak, you cannot do the heavy duty things. Once you hold something that is heavy, your bones are brittle, they break easily. You have a simple impact, you're broken. Unlike when you're strong enough, you just fall from a height, you stand, wipe yourself off, you keep moving. That's the difference.
Okay, and maybe you can tell us what are some of the common orthopedic conditions you encounter in your practice? Because I don't know how long you've been working at St. Francis Community Hospital in this field.
It's been long.
So you can tell us.
Since 2021.
Oh, wow. Okay, amazing. So you can tell us more about your interaction with the patients who come to see you there.
Basically, the common orthopedic and trauma cases that we have, we begin with the largest, it's the fracture. After the fractures, we have the ligamental tears. After that, we have the joints, that is the arthritis, the osteoarthritis, and the osteoarthritis and rheumatoid arthritis. Then we have the ligamental, so we have a lot of them in bracket that we take care of. So we begin with the fractures that are caused by the accidents, fall, trauma, assault. We have a lot that causes fracture. We manage them. The wear and tear as we grow old, that is the arthritis. We have the osteoarthritis. We manage it. Then we have the rheumatoid arthritis. That is when your immune fights with you. You have your immunity, but now it is fighting with you. It brings around the rheumatoid arthritis. We also take care of it. So we have a lot that we go through in the orthopedic.
Okay, and I understand that sometimes we may fall down and we have those injuries, but not all times that we come to the hospital. What is that? What is associated with a person maybe falling down and then you get maybe a pain? You experience pain once in a while, and then you don't come to the hospital. What are some of the dangers that can be associated with that? You just assume, oh, it was a small, accident. I don't need to go to a hospital. Or maybe you just take painkillers there, and then you don't go to inquire and to have a consultation with your doctor. What are some of the dangers can be associated with that? Can it occur in future that you find you can have dangers in relation to, orthopedic, diseases?
It plays a role. So when you get the injury back at home, some of people, you think like maybe it is just a strain, it's a sprain, you just maintain. Some people do the hot water massage, which is wrong. You don't do that. You can do the icing. So once you get the injury, you don't go to the hospital. Some people go to the pharmacy back home and chemists, as we call them. You're told, you know what, it's just a false soft tissue injury, do a crepe bandage, go home. that is very risky. Basically, if you have an injury, for you to be sure you're not in the wrong side, we need to do an X-ray examination. That is what guides us. Once we do the X-ray, it tells us more about you, the inner you. Is your bone safe? Is it broken? How do we go about it? So in case you stay at home, you have a broken fracture, what happens? It makes the situation worse. Since when you get the fracture, you continue, maybe we put it on the leg, you continue bearing the weight on it. What happens? It dismantles, it displaces. So when that happens, you have a shortening and the pain never goes away. You do your painkillers again and again, the pain never fades away. So what happens? You tamper with your bone, it gets something we call non-union or malunion, you have a shortening, and then you're not safe. Your kidneys, once you do the painkillers for a long duration, you also damage your kidneys. So that is the damage you can do once you do that.
Sometimes people say that orthopedic maybe diseases and of course complications are related to aging. Maybe you can expand on that. What age are we talking about here? Because you've ever seen some kids with fractures and they come to the hospital with their parents.
Sure.
Does age matter?
True, it does. So with the human body, we behave like vehicles. We have the wear and tear. The more you use that vehicle, the mileage and stuff, it is worn out. The body does the same. The more we are aging, the wear and tear becomes greater because you're using it, you're bearing the weight on it, you're using it day in, day out. So we, the human, we also wear out like the vehicle and anything else. When you use it, it goes away. So with the human, we also, the age also is also a predisposing factor towards the bone fractures and weakening. So we need to live a healthy life for us to achieve that. So once we are old, the risk is high. Sure.
Okay. And what are some of the factors that contributed to having these maybe orthopedic concerns that you need to go to the hospital? And of course, you can tell us some of the signs and symptoms that one need to or maybe observe themselves and see. When it is a big concern to you, you can be able to go to have consultation with your doctor. Because as you mentioned when we began with the conversation, you talked about lifting some heavy weights. And sometimes you find there's some of the maybe Kenyans who do like they lift a heavy machine.
Sure.
Let's talk about the foreman. You know, so many people love to make memes with the foreman part of it. How do you say that? Does that maybe a factor contribute to people having issues with their bones in future?
No, the foremen, the strong guys who are at the site who do the heavy duties, they are lucky. Because once you exercise, you make your body strong. Doing the exercises, having those duties in you, you make your bone strong. So once you have the disuse in the bone, that's when they become osteoporotic. What do I mean by saying osteoporotic? They become weak. They can't resist. But you can make them strong. That is the lucky side of it, since you can achieve, you have that side of it, but we can still achieve and maintain our health. So for the ones who do the duties, they are lucky. For we who sit down all day under the roofs, kind of risky. We are not lucky, but we have a way we can overcome that. So for the people who work, who don't have the time, you can create your own time. So how do we overcome the damages that can come to our bones? We have the exercise, the lifestyle habits. If you are heavyweight, you need to lose some weight. So basically, we have a lot we can work on. So what do I mean when I say about the lifestyle? How do you manage your meal? What do you eat? What do you take? Are you the snack person? Do you have the carbonated drinks? What do you take? So basically, for those who love the carbonated drinks, and you think you need to reduce. For the junky people, the chips, the snacks and all that, you need to reduce too. So what we do, for the healthy part, you need to do your balanced diet. You need the vitamins, the carbohydrates, the proteins, and the fruits, the vitamins. So what we do basically in your meal, I don't know how many people do that. The carbohydrates, that is the ugali. We need it in a little portion. When you do your meal, make sure a third, that is the carbohydrates. The ugali should be tiny, the grains and the protein should be much. But here we do
the opposite.
So that is what you never watch. You find people, they do a lot of carbs, but they don't do the protein, the vitamins, and their fruits. Others don't do their drinking of water. We don't do. At least in a day, in a normal day, you should take at least 2 liters. If you're in a position to do 3, you're safe. So also that is the part of lifestyle. What about the exercise? We need to make our body strong. We have to work out. How do you do that? Even walking. it assists a lot. When you do your walking, you can now, instead of doing the Uber from here to connect to the main road, you can just do your walking. You can be there, you do your purposeful walking. You can do cycling. It also helps a lot. So basically, that is the part of exercise we can do it. It will help us a lot.
And so you're telling the viewers to always find a way, maybe just make a hobby. That's what you're trying to say. For example, like cycling. Yeah, making it a habit.
Yeah, make it
and of course, sometimes you find that people saying, you know, I normally walk out from maybe where I stay to the stage around maybe 5 minutes, of which they term that as my part of exercise.
Yeah.
Do you really advise on that?
For that, I can call it, it's not purpose for walking. You're doing it for a duty. But you can do it from your house. You know what? I'm doing my work. You have your timer. Today we have the watch. We have the phones. They are now smartphones.
Yes.
They can time. You can tell the steps you've taken in a day, how many calories you've burnt in the day. So I think the purpose for walking, that is what basically does. Just get up, prepare, do your good footwear, your clothes, take your walk. So basically, if you do that, that will be better. But if you do the normal walking, you know what, I'm in my 1, 2, 3, taking care of my errands, not really.
It doesn't apply.
Do it on purpose. I have my 10K kilometers I have to do today. Do them on purpose.
Okay,
Yeah.
All right. I thank you very much, Marianne, for, you know, it's a very interesting conversation, because I understand that a lifestyle plays a very big role when it comes to maybe diseases. If you take a look on the diabetes part of it, more of the sedentary lifestyle, it's associated with these diseases and whatever the conversation we are talking about here today. And maybe you can take us through when a patient comes to St. Francis Community Hospital with a fracture, whether a child or whether a grown-up, whether those are, you know, our grandmas and our grandfathers, when they come to the hospital, what are some of the steps that you take? Because I understand there is a point that reaches and a patient might need a surgery. How do you determine that?
Wow, that's a good question. So how do we go about it? We have your walk-in at St. Francis Community Hospital. We do the first thing, you do the triaging. You're going to do your weight. We need to have your personal information, your age, who are you, your age, where you come from, your occupation. We have your data so that we can know basically where to begin. After the registration, we know your temperature, the health condition, the basic ones, temperature, the weight, height, and all that. After that, after the triaging, we put you in the system. You're able to do now. We can do our examination. That is when I come in. I do the examination. I can tell what do we need. We need an X-ray, but from where? Is it the elbow? Is it the radius and ulnar? Is it the knee? Is it? We have a lot of parts. We have 206 bones, so we need to know what we are examining. Since we can't do the whole body X-ray, that's when we do the examination. So I can determine where is the pain. How do we manage it? So that is if we find out it's the radius and the ulnar, that is the hand. We're gonna do an X-ray. That is what guides us from the next step. After doing the X-ray, that's now where we tell where are we. Do we need to do the plaster application now? If we do the plaster application, we have some people who have the fractures that are quite displaced. For the displaced one, we give them a chance, we do reduction. If the reduction fails, okay, in fracture management, the bone management, if it has a fracture, which the fracture is a break in the continuity of a bone cortex. So if once we find it's broken, displaced, we do the reduction. If the reduction fails, that is when now we go for the surgical intervention. In fracture, we have two managements, the one we do without operating and operation. We have only two options. If we can't do with the plaster, that's when we go for the surgical intervention. So if the reduction fails, that's when we advise for now surgery. But before, we do the plaster. So that is where the surgical intervention comes in.
Okay.
Yeah.
And I understand sometimes when you tell a patient that you will undergo the surgery bit of it, it might be very shocking, and some patients don't like surgery.
I know.
How do you go about that? Do you have a counseling maybe session? How do you work through such a patient in the hospital?
Yeah. So the basic thing we do after we find out like the management, the close reduction management without the operative method is not going to work for you. We have a moment with you and a talk. We weigh the option, we give you a talk. We explain to you the advantages of doing the surgery and the disadvantage of doing the surgery. We also get to you and we make you understand if we don't do the surgery, what will happen later. So we put all the options on the table for you to decide. We give you some time, you go take your time, think about it. Will you choose the side that has more advantages, or do you go with the other one? You don't do the operation and face the disadvantages. Now that is where we weigh the option for you. We explain what happens if we don't. Then for you, take your time, you decide. Since you'll be in a world where you understand what will happen after. Then after that, you decide. So we cancel, we give you time to think about it, because some like surgery, no way.
Yeah.
Then you have to give you time, you decide on what you want, then you'll get back. That's what we do.
Okay, and our conversation now is more of stronger bonds, of course, and living a healthy lives.
Yeah.
And you're trying to, enlighten the viewers on some of the ways they can do to ensure that they have stronger bonds.
Yeah.
When we talk about a patient experiencing some joint pain and maybe bone pain, how long are you supposed to observe yourself? Because sometimes, as we mentioned earlier when we began with the conversation, you find a person, you feel, my joint is paining me, but you say, it's a one day. You don't actually take it so serious. Sure. You just say, maybe, there's something that happened during the day, or maybe I tripped a little bit. You don't pay attention more. Sure. How often should we pay attention when we feel we have joint problems, we have bone issues, so that we can come to the hospital at St. Francis Community to get more consultation and maybe to do a follow-up on how we feel on our bodies?
Thank you. For the we advise with immediate effect. We would rather come to the hospital early, you find you safe and go back home. Unlike staying at home, you buy more time, you waste more time, you come back when it is quite more dangerous to reverse whatever has been happening. The earlier, the better. So the slogan, even in hospital, it's better. You can come early, we are able to manage either by painkillers, by exercise, and you're good to go. Unlike you staying at home, we buy more time and we come when it is already late and we need to do much. Unlike which you could just have used some drugs and you're good to go and exercise. Unlike now when you have no any other option, unlike surgery. Yeah, so the earlier, the better.
The better. Okay, and taking you back on the aging bit of it, aging, everyone will age at one point, because we cannot be able to maybe do something about that, because we'll have to get older at one point. How do you maybe try and see the way you can be able to live your healthier lifestyle and prevent when you reach maybe by the age of 70s, 60s, you'll not be exposed too much, and your body may be able to take, you may be able to live a healthier life and, of course, continue with the daily activities, because sometimes you find, especially on, in Ushago, you don't find so many people complaining because, back in the Ushago, there's a lot to do. There is, farming. Active. Yeah, your body is very active, and you find even grandmothers over 100 years, 80 years, they're very even okay to continue doing their daily activities, whereas some of us who live in urban areas, we complain a lot because we tend to have those sedentary lifestyle, and of course we don't watch even our diet, which you talked about, getting those fast food. When you come out of work late, the first thing you think it's going to, or that, fries, joint at your area. Maybe you can tell us more about that.
The exercise thing and how we make our body strong.
Yes.
So for the people who, like the urban people here, the people we are living in the towns, I know, the bodies are older than our actual ages. That is how we are. Like we have a grandma, I lost my grandma at 102 years. And she has never sustained any fracture, any joint pain, anything at 102. But we, even at 20, we have the old-aged people. Our body are aging than we actually are. So basically, the exercises I'm talking about is the cycling. If you do cycling, you strengthen them. You strengthen your bones. So meaning they'll not be exposed to those weakness and all that. So when you do your exercises, you make them strong. Basically, you don't have to go to the gym. You can even be doing them at home. You just create your 10-20 minutes every morning. You stretch, you do 1, 2, 3, you're good to go. You can also watch your diet like we have talked. Then we live in these apartments. How many minutes do you take to sunbathe? You don't. So basically we are just in the buildings, we don't. You can supplement that with the vitamin D3. There is some capsules we do. You can be taking them, they're either monthly, the daily one and all that. They even substitution for the babies, because if I happen to conceive, I live in these roofs. The baby will also be in the insufficiency. So we have a lot of deformities in the babies that they are born with, because we don't have the direct sunlight that we watch. for the absorption. You can also be sunbathing, but the diet you have doesn't help in the absorption like it is supposed to be. So we also supplement instead of just staying that way to make them strong. We have the gyms, like in the hospitals, we also have them. We have the TheraBand. There is a band we use. It have different strength of resistance. We do it. It strengthens the arm, the lower limbs. So once you have one, you can be doing that at home. It's called a TheraBand. So you use it to make you strong. You walk. Then you avoid the high impact exercises like the running. That is a high one. So once you have the pains, avoid such exercises. If you feel your knees are aching, your hips are paining, kindly stop the high impact energies. Which are they? The skipping rope. I have seen the fluffy people trying to do that to lose weight. It's a no way. You'll dismantle your joints. The knee and the hips will complain. So if you have those, you are bulky, you want to lose weight, watch your diet. It's not the exercise. Actually, if you have a good diet, 80% you lose your weight. 80% of losing your weight is through the diet. 20% via exercise. What does that mean? You can lose your weight via watching the diet, not even working out. So watch your diet, do your exercise. If you have any pain, just walk in the hospital and inquire, and they'll take care of you. So basically, that's how we're going to go about that. Yeah.
And of course, I'm curious to know, because I understand we have about like 2 minutes before we go for a break.
Sure.
Does sleeping positions affect on maybe the joint pain? Because sometimes you feel maybe when people just sleep, maybe whether they're looking up or with their stomach, sometimes they wake up and they find, oh, like I have a joint pain. Does it affect?
What determines is the mattress you have.
Okay.
You need a firm mattress, not a solid one, and not that soft. We don't need, when you sleep, it takes your curve. We need some resistance, because there's the normal S of the back. So if you happen to exaggerate or you happen to twist it more further than it is supposed to be, it will definitely pain. Since the only way they send signal, the back or the body sends signal, it's by aching. To me, I'm hurting. So that's the only way they send the signal. So if you happen to feel like, you know what, I wake up in the morning, it feels like I've been digging all night, what do you need to do? Check on your mattress. Maybe you have the wrong thing in your bed. Yeah.
Again, still on that, I understand there's some of the ways on how you're supposed to sit when you're working on your computer. Sometimes you find people, you know, they have lifted their computer up, they're lifting their legs. Which position are you supposed to maintain? Or, well, maybe you're working on your maybe computer or even sitting down.
Sure.
Yeah.
I think this is the position. You should be at 90 degrees sitting position. Do not hurt your neck back there as you do. Make sure you're upright. Whatever you have, it should be at your comfort zone. Then we have these people who hutch. It's suicidal. Because the back has its sweet, exaggerated S. Meaning when I bend, I exaggerate the S or I straighten it. It hurts the muscles around. So if I happen to be in that position, it will hurt me and it will complain. So that's why we are aging before we do. If you watch your sitting up like at 90 degrees position, you have your healthy back. It will maintain as long as possible.
Especially for the younger Gen Zs. Always sitting like that.
Yeah, with your phone, with your head bent. It's very wrong. So if you're using your phone, if you can be here, better. But this way, no, it's a bad one.
It might affect your future
health. It will.
It will.
Definitely.
Wow.
Yeah.
Very nice. And that's why, you know, Capuchin TV, we are very concerned on your health. And that's why we bring you this conversation. And we help you understand on the ways you can be able to do to, you know, actually maybe have some habits to ensure that you continue living a better lifestyle. And we say your health is your wealth.
True.
And that is the very important information that we need to lay out to our viewers. And I can see our timer is up for the first part. So we're going to take a very short break. But when we come back, we shall continue on our conversation in terms of the advice. Maybe, Marianne, you can be able to lay out to the viewers and to the patients, for example. And of course, I understand you have an upcoming orthopedic camp. You'll be able to shed more light and give out details to our viewers so that they can visit St. Francis Community Hospital to have all these services and to ensure that they continue to have healthy lives. Stay tuned for that. And in case you still have any question you'd like us to ask our guest here today, please do not hesitate. to reach out to us on 0717 424 866, or you can use the SMS number that is 21760. You can also leave a comment on YouTube and Facebook page where you are watching us on this conversation, and what have you learned as we continue on to our discourse. Let's take a very short break. We'll be right back in just a few. Don't go far.
Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth.
Every child is unique, and so is their journey to health and well-being. At St. Francis Community Hospital, Kasarani, our pediatric department is dedicated to guiding that journey with expert care, compassion, and commitment to excellence. From the very first breath, our specialized neonatal services ensures your baby receives the best possible start. Our state-of-the-art neonatal intensive care unit is equipped to handle even the most delicate case, ensuring the smallest patients get the strongest support. As your child grows, regular health checkups are crucial. Our pediatricians provide comprehensive assessment, development, screening, and immunization, supporting health growth every step of the way. Health is more than just prevention. Our team of specialist pediatricians provide a range of acute and chronic conditions, from asthma and diabetes to rare genetic disorders, with advanced diagnostic and personalized treatment plans. We also offer comprehensive rehabilitation services, including physical, occupational, and speech therapy to help children reach their full potential, overcoming challenges with strength and resilience. Our hospital is open 24 hours a week. Visit us today for specialist pediatric care.
Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth.
Hello, dear viewer, and welcome back to our Health Corner show right here on Capuchin TV with me, Maureen Kimani. And in the studio, I'm being joined by a guest from St. Francis Community Hospital in Kasarani. There is Mary Ann Muthoni, an orthopedic and trauma technologist. And in case you are joining us right now, we have been engaging in the conversation on how to make sure that we have stronger bones and stay healthy lives. And of course, you can just telling you on how you can take charge on how to have, healthy bones and healthy joints. And in case you have any question, please reach out to us. And of course, in this part, we shall be delving more on the treatment option. And of course, for those patients who go the physiotherapy sessions on how you are supposed to do it, maybe after the surgery bit of it. And of course, the upcoming activity at St. Francis Community, that is a orthopedic camp We shall be giving you details on when it's going to happen and from what time to what time, so that you can be able to visit and access all those services the St. Francis Community Hospital Fraternity is offering. Welcome back to our second part, Marianne.
Thank you.
Yes, I'm loving this conversation. It's very enlightening, and I'm sure the viewers are, grasping a lot of information, and especially on the sedentary lifestyle bit of it.
Yeah.
They'll be able to rectify on what they have not been doing to ensure that in future they may not be associated with such diseases, of course, and complications as well. So take us through, because we've dealt more on the introduction bit of it, on what happens when a patient comes in. What about when it comes to treatment option? Of course, we have the physiotherapy sessions as well.
Yeah.
Maybe you can tell us more and expound a bit of it on what a patient is supposed to do.
Thank you. Once we have our patients, especially now the surgical patients, we do the surgery, we give the do's and the don'ts. We have the do's and the don'ts once we do the surgery. Initially, after we do, maybe we can quote one, we can go for the knee replacement. Once we do the knee replacement, we have the cut, the wound and all that. So you advise not to come into contact with the water. You have to take good care of the wound. Then after that, we have the do's and the don'ts of how to walk. You need to walk with your crutches, a pair, not one, but a pair. So you have the pair of crutches, you have to put some weight partially. You begin with partial weight bearing so that you can be rehabilitated back to your normal life system. Once we do an implant, we begin with partial weight bearing with a pair of crutches. So you don't have to put the full weight on it. You can disorganize whatever was put inside the joint. So partially, gradually, you're going to be putting more weight. In a few, you're going to drop one crutch on the opposite side, continue bearing weight now on the leg. Then finally, you're going to drop the two. We have the physio sessions. We give them even as much as even 4 times in a week. It depends with how the joint, the range of motion is. So if you're told by the doctor you need 3 sessions in a week, 4 sessions in a week, we know the reason behind that. Because we begin with more sessions, gradually we go minimizing the sessions, and finally you're going to be doing your own rehabilitation at home. We have these patients, we advise them, kindly be there for physio. So it is very important if we have the physio people. Why? They help you back to your normal life. The range of motion, we don't need stiffness in the joint. So the only people who help you out is the physio guys. So it's very efficient, it's very good if you follow up on your physio sessions. Thank you.
And how many sessions are you supposed to go about?
The sessions determine, it's your body. We have different types of people. I can get a cut here, I take only 7 days and I'm good to go. Someone goes even for 7, 10, 20 days. It depends with individuals. So we can, it doesn't have the exact. We'll come there, you do your physio session, we examine the range of motion until now we release you. So it's not exact. We are not the same. We are different. We recover differently. So that's how it goes.
All right. And something just crossed on my mind. When it comes to ladies' lifestyle, we wear even 6-inch of heels. Can it affect maybe our joints and how maybe we move on? How long are we supposed to stay with it?
That's one I need you as the high heel shoe does a lot. Actually, the shoe wear does a lot on you. So if you have the high one, you'll be feeling something at the back, because once you have the elevation in you, there's a change in position in your back. So it also affects your back, the muscles out there, you'll be having some spasm. So actually, as time goes, there's a time you feel, you know what, I'm not in a position to be putting them on. You'll have to release them. They also overstretches the gastrocnemius there when you have the high position, because it's tilted. It's supposed to be this, but you're overstretching it into a higher position. You can be putting them if you're comfortable, but once in a while, make sure you have a low shoe. The best shoe that you can be putting on to avoid a lot of injuries, even the foot has also another condition. People complain of the heel that has a lot of pain. It's called plantar fasciitis. It's when you do a poor shoe. That is, what do I mean when I say a poor shoe? It has a very, we the ladies, we have this shoe we call the dolly shoe. It doesn't have an insole. I think when you walk on that shoe, you feel like you're walking on the stones, like you're barefooted. It's not safe. The ladies, we are every now and then complaining of our foot. Why? The shoe wear. If you do your sneaker, if you do your good shoe that has a good padded insole that has an arch support, you'll never complain of the foot pains. So we also need to watch on what we put on. If you're going for the walk that we talked about, the walk we need, the 10,000 steps you need to do, put a sneaker on. It is very comfy for you. It will not hurt your foot. You'll be good to go. You feel like you want to go for more and more. But if you have a hurting shoe, you cannot go for a long distance. So also the shoe wear matters. The ladies, if you have the wedged shoe, it can be high, but wedged also gives a good support on there. It also balances the weight pressure on your foot. It helps you a lot. Thank you.
Okay, and when we began with the conversation, you mentioned something to do with accidents, of which in our country it has become a very huge deal. You talk about the Navy Bridge, we have the Salgar, and you find every now and then maybe there's a breaking news on the accidents bit of it. But what happens? So many people, when they feel maybe they were not injured or they can't see blood on their body, they don't tend to go for a checkup. And you mentioned that accidents play a very big role when it comes to orthopedic.
True.
Tell us more about the orthopedic trauma care.
So in the orthopedic world of the trauma care, we need to be very attentive. One, we have the pain. We have the basic thing every Kenyan has been doing. I don't know who advised us on the hot water therapy. Anytime at home you're hit, you know what? Majimoto and salt. Basically, we should not be going for the hot water. So once you are injured, never rush for the hot water. What you do, you take your icing. Basically, maybe some people don't have their fridges at their home. You can just go to the market, get maybe a nice cold soda. You can also do that. You hold it with a piece of cloth and you massage the area that has been damaged. If the pain persists, don't take any time at home. Don't take any chance. Sometimes you think like, you know what, I want to take 1 or 2 days and feel how my body takes or how it controls that. You need to go to the hospital, especially if you're involved in an RTA, the one who said an accident. Walk in the hospital, just have a general checkup. Some people get hit, you get the trauma, a clot happens, it travels into your body. Now, here we come in a critical emergency, someone gets attack, down, dead because of those clots. So we don't need to expose ourselves to the thrombus diseases. If you are in an accident, just walk in a hospital, get a checkup, the physical examination, then you're good to go. The issue of we at home taking every now and then, we have our drugs, we have our bucket there with painkillers. Don't do that. You'll damage your kidney. So if you feel the pain, just walk in a facility. You're going to advise you accordingly. So the drugs taking every now and then, you're not taking good care of your kidneys. So think about your kidneys as you take your painkillers at home. Yeah.
Wow. Let's talk about the upcoming orthopedic camp at your hospital, because that's why we are having this conversation, to create awareness and to tell the viewers that there will be a day that you shall be having this camp, and you have some of the services that you'll be offering during that day. A lot. Break it down for the viewers to understand more. And of course, we shall be getting maybe a banner that shall be displaying on your screen as you maybe shed more light about the details on that camp.
Well, come all, come one, come everyone. We have the mega orthopedic camp at St. Franciscan Hospital. This is the place where we're gonna be hosting all about if you have any bony issue, if you're feeling pain, if you need any plating, the people the age that have got the arthritis, the osteoarthritis, the rheumatoid, we're gonna be taking care of all that. So the people who need the joint replacements, kindly be there. Come early, we're gonna be attending to you. The dates, mark the dates next week. It's very soon. Next week from Thursday, that will be 10th, to Sunday, that will be 13th. So we will have an ample time for people to come in, to be checked, to be given everything. Then for the amputees, we have good news for them. The lucky number one will be getting a free prosthesis. That is the artificial limb. So if you'll be lucky number one to be there as an amputee, lucky you'll get a free prosthesis. So we also go for the amputees. We need people to be restored back to their function. They're going to be good. We want you back. You'll be active. You can go here and there. You're going to be able to communicate with people. So nothing should keep you down on a wheelchair. You're going to be offering the prosthesis. So if you need a knee or whatever, a limb from the below knee, from the hip, the prosthesis for the lucky number one, and the rest, they also have the discounted one fee. So don't feel like, you know what, will I be the number one? Never take chance. Just walk in. You might be the lucky number one. You have your prosthesis. The arthritis people, that is the knee, mostly the common ones. It's the knee and the hip. the ones that may be requiring the replacement. If you have the knee, the hip, arthritis, the severe one, just walk in the day. We're gonna be taking care of you. We're gonna advise you much more on it. The replacement will be taken because we'll be having the orthopedic camp with our great good surgeons. We'll have a great team that each and every day we have a team of them that will be working there. So anyone who needs that, walk in there, you're gonna be assisted. For the babies, they are not left out. There are babies who are born with the knock knees. There are babies who are born with the bow legs. Even them, we have good care of them. Walking, we're gonna be taking you through. We're gonna be helping you out. We're gonna know how to go about it. We have to restore the beauty in us. We have to restore the future of our babies. So if you have anyone with the knock knees, the bow legs, walking, you're gonna be correcting those deformities. And the people, we also have the physios. The people don't think, oh, now that I'll be going there for surgery intervention. What about my physio? What about my rehabilitation procedure? We got you. We got the full equipped gym. We have our physio guys, the team. We have all that you need in the hospital. So all of you, come one, call everyone. If you have someone, kindly, if you have the information, pass to them, let them know. There'll be that mega camp for them. They come, we help them out. Anyone needing anything, it's all in one place. We're gonna be having it all. Anyone who needs what, they're gonna be crutches for those who need, the prosthesis for those who need. So all of us. You're gonna be there, the aged, the young, the who. For those who have been in long queues waiting for the surgery session, for the plating after accidents, we also have that. So anyone who needs surgical intervention, rehabilitation, we have the full team there. We're gonna take care of everyone. Yeah.
All right. Thank you very much for laying that information on about the orthopedic mega camp that is going to happen from 10th to 13th of April at St. Francis Community Hospital, Kasarani. I think if I got it right, did you mention on the time from what time they can be able to visit the hospital?
Anytime from morning 8, you're gonna be there. We're gonna be there early enough because we have the night people who are gonna be there. So if you come as early as possible, you will not be stranded. Anyone shall be there taking good care of you. So just come in, we go through. We're gonna not have any fixed time of the closure because if you're in, we cannot say, you know what, you have to go home. But once you're in, we're gonna take care of you. So you're welcome.
Okay. Yeah. And I can see we have a question here from Mike. I don't know if it's relates with a conversation here today. And he's saying, kindly ask Marianne, kama rheumatic fever huclear kwa mwili and what someone can do whether they experience the pain.
Okay, so if you have such pain, you have to walk into the hospital. We also need to do some blood works. If you have the fever that never goes away, we need to know what is happening. Sometimes it might not be the soft tissue, it might be something inside. Because if you have sepsis, that is the blood infection, the body tends to hit around the affected place. So if we do the blood work, we are able to tell and advise. We are able to prescribe the good drugs that you have to clear if it is an infection. So you don't just stay at home, you do your medication till never fades. Walk in, we do some blood work, you're gonna be helped out. Yeah.
Okay, and maybe I hope, Mike, you've been able to maybe have that answer on your question. And thank you very much for sending that, for sharing your question and feedback on our conversation here today. Thank you very much. And I understand our time is almost up. As we wind up with the conversation, of course, we emphasize on the mega camp that is going to happen. Is there a way maybe people can be able to register or even maybe have some calls before attending, or is there something they're supposed to do there?
We have our 24/7 numbers that work 24/7. You've got any inquiry, you need to know about anything, you need to know the location. We have the numbers on our tag that you can get to us. So if you make a call, we're going to advise you accordingly. You're going to feel at home, even though it is in the hospital.
Okay.
Yeah, and for anyone who's going to be working in, if you have some previous images like the x-rays, the MRI and all that, you can have your medical history with you. It makes it quite easier, unlike investigating again and again. And also for the the examination, the D-Day, the X-rays, the CT, and all that, we're gonna be offering. So they're gonna be there. They come. It will be all in one. That's why it's a mega camp. Yeah.
All right. And what's your key message to people regarding on bone and joint health? Because you've been talking for about 40 minutes, having this conversation, talking about treatment, talking about science. Maybe what is that message you'd like a viewer to take home, especially for those ones who might be joining the conversation right now?
Oh, well, anything I would like to say about it is like the skeletal part, it's the basic body for we. Because if you don't have the bone, you don't have a body. If you take off the bone from you, the skeleton, because that is the back of you, that is everything on your body, it is supports, it's the weight bearer, it does everything for you. What I would like to say is take care of it. When you have a chance, kindly take care of it and it'll take care of you. Once you give something good to it, it gives back to you. So anytime you take care of it, it'll always be there for you. It'll never leave you. It'll always got you. Yeah.
Awesome, awesome. Thank you very much, Mariana, for making time. And there's a person who is asking if they would love to get in touch with you. How can they do that? Of course, we have the Kasarani number, right?
Yeah. The 0701, it is on the board. So that is the number they can get to us. And if you walk in there at the St. Francis Kasarani Mwiki, you're going to find me there, the orthopedic department. I got you.
And maybe just one more question for the patients who have maybe orthopedic, issues. When can they visit a normal day checkup?
Oh, anytime.
Yes.
If you happen to be in an accident, you can just walk in. We have the 24/7 services we serve there. There's no anytime you're going to walk there and you're not helped out. So if you just walk in, we're going to help you out. Then for the orthopedic clinic, that is the specialist clinic, we have them from Monday to Friday. So on Monday from 9, we have a doctor. On Tuesdays at 2, we have an orthopedic doctor. On Wednesday, we have an orthopedic doctor at 9. Then Thursday, very early in the morning at 8, the orthopedic doctor is there. On Friday from 11, we have an orthopedic doctor. So every day no one is left out. You can create a day for yourself to come in and be assisted out.
Okay.
Yeah.
Thank you so much, Marianne Muthoni, for making time and for sharing a lot of information to our viewer concerning on how they can be able to keep their bones and their joints strong and to make sure that they live a healthy lives. And mine is to just say, remember that small lifestyle changes can make a very big difference. For your life.
It does.
So especially on the diet bit that Marianne has been able to touch about and just to emphasize on the mega camp that is going to happen on 10th and 13th April. That is from next week, from Thursday to Sunday. You can definitely visit St. Francis Community Hospital, Kasarani, to get the services. There is a free consultation now of blood pressures. There is random blood sugars. You can also be able to get some back pain treatment, joint pain, shoulder pain, all that we've been able to talk about in our conversation, in our discussion here today. You'll be able to get all those services. And of course, St. Francis Community, apart from that bits that we've been discussing here, they also have other services that they offer. So make sure you don't wait until you get to experience a lot of pain to visit the hospital. Go for free consultation. Take advantage of these beautiful services the St. Francis Community Hospital is offering at Kasarani. And mine is to say thank you to all the viewers who were tuned in to this conversation, starting with Joel Anganga. Thank you very much. I can see you're saying you're tuned in the conversation. We have Kevin Cheriot, and of course we have Mike, we have Sarah. Thank you very much for your support and for your feedback as we continue with the conversation. Thank you so much, Marianne, once again for making time and for sharing those beautiful insights to our viewers. I hope they've been able to learn a lot and make sure they spread the information, especially on the upcoming mega camp at Kasarani Hospital, that is St. Francis Community Hospital in Kasarani. Don't keep this information to yourself. Help your neighbors, help your relatives, help your sisters, help your colleagues as well, and God will bless you for spreading the good news and for evangelizing. Sure. So thank you very much. My name is Maureen Kimani, and our guest has been Mary Ann Muthoni, our guest from St. Francis Community Hospital, who is an orthopedic and trauma technologist. And allow me to say thank you, to extend my gratitude to Capuchin TV crew who are behind the scene very early in the morning to make sure that they are able to transmit this live stream and conversation to you at your comfort zone. Starting with Willie Mutua, our camera person, we have Frederick Ochieng and Calvin Zissa. Thank you very much. Have a blessed day. See you next time.
Leo nimekuletea tiba. Hello. Welcome. Ni daktari wako profesa hao. Na leo nimekuletea tiba ya arthritis. Yes, arthritis. Ushaikuwa unasikia tu mifupa inaanza kuitana. Uchugu kwa mifupa, joints zinauma. Yaani mifupa lazima zijioneshe ni kama ulikuwa umesahau ziko na zinataka kujio. Now, hapa St. Francis Community Hospital Kasarani tunakuletea mega camp ya mifupa. Hii ni mifupa peke yake. Mifupa ikiongea nyumbani kuja tuinyamazishia hapa. Inakuumia huko tunakuja na sisi tunaimalizia hapa. Hii mambo ya arthritis ya watu ulizaliwa miguu imekaa hivi tunairudisha. Reconstruction. Miguu ambayo magoti inapenda kugongana ni kama cabinet. Hii inagongana tunainyorocha. Unakaa vizuri. I'm telling you. Karibuni sana tarehe 10 hadi 13 Aprili. Mwezi wa 4. Hiyo ni camp ambayo ukiingia consultation ni free, au lipi kitu yote. Abia mtu yote huko Murang'a ni free. I'm telling you. St. Francis Community Hospital.
Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth. St. Francis Community Hospital, located along Kasarani Mwiki Road in Nairobi, stands as a pillar of hope and healing, providing top-notch medical services to the local community. The hospital is renowned for its specialized care in obstetrics and gynecology, pediatrics, cardiology, and gastroenterology, ensuring that patients receive expert treatment across various medical fields.
Welcome to St. Francis Kasarani Community Hospital Dental Clinic. My name is Wamboige Tukui, the Community Oral Health Officer here. We are open Monday to Friday, and we offer a number of services. We do the oral examination, we do extraction, full mouth scaling, masking, braces. We also have our oral maxillofacial surgeons on board. You can always book with us.
We are doing spectacle prescription, comprehensive eye examinations, eye surgeries, among other services. We are SHA accredited, so if you have an eye complication that requires surgery, we are SHA accredited, and we have a successful rate of cataract surgeries. I would wish to welcome you all and have a visit and get your eyes checked.
Equipped with state-of-the-art diagnostic services including X-ray, CT scan, and ultrasound, the hospital boasts a 24-hour laboratory and emergency department, guaranteeing round-the-clock care for those in need.
Beginning from routine tests, that is stool analysis, we do urine analysis, we do H. pylori, Salmonella, and all parasitic organisms. We do isolate. Then we have our microbiology laboratory that does culture and sensitivity, whereby we go deep into isolation of antimicrobials from specimen from our clients. Then we have hematology section, whereby we do total blood counts, whereby we check the level of blood, we check the level of platelets, the level of red blood cells in our blood, infections, that is viral, parasitic. We have biochemistry section, whereby we do several tests, beginning from kidney function tests, we do liver function tests, we do lipid profiles, we do thyroid function tests. We also check the hormonal profiles. Finally, we have our immunoassay, whereby we do screening of blood. We have a donor center at our institution, so we do screen our blood. We do HIV screening, we do hepatitis B and C and syphilis screening. Also, we do the hormonal profiles, that is the thyroid profiles. We do the anti-Müllerian hormones. We do all sort of profiles that are incorporated in the immunoassays.
Its maternity and gynecological ward is designed to provide a safe and comfortable environment for mothers and newborns, while the surgical ward and theatre services cater to a wide range of procedures, from minor surgeries to complex operations. Beyond medical treatment, St. Francis Community Hospital prioritizes holistic patient care through physiotherapy, rehabilitation, nutrition services and spiritual support via chaplaincy and counseling.
As a chaplain, we take care of the pastoral needs of the patient, that spiritual part of it. We also concerned with their emotional part of it, part of our patients. So we do a lot of counseling, we do a lot of spiritual care, we pray for the patients. We must see each patient when they are cold. We pray for them. We bless them. If they have any need, spiritual needs, we take care of that.
The hospital also runs specialized clinics and comprehensive care services, reaffirming its mission to enhance the well-being of the Kasarani community. With a steadfast commitment to quality healthcare, St. Francis Community Hospital remains your partner in health and well-being, where compassion, excellence and innovation come together to serve the Kasarani community and beyond. For more information, call us at 0741 689 983 or 0795 431 113 or 0112 466 501.